Next, we have LeadingAge New York.
Hi, I'm Jim Clyne, the CEO of LeadingAge New York. We represent over 500 or 400 not-for-profit and government long-term care providers, from nursing homes to HUD housing. I wanted to cover 5 areas and give you a little context. The first is the budget is a great start on the Medicaid side, but a 1% increase is not nearly enough. If the 14 years of COLAs had not been repealed, the Medicaid rate for nursing homes would be 31% higher. I don't think you're going to do a 31% increase, but certainly 1% across the board is not nearly enough to make up for the underfunding. We support the governor's initiative on staffing and quality funding for nursing homes. We think it's important to reward good providers. I just want to clarify the impact of the budget on assisted living, which is a little bit confusing, I think. There's an assisted living program, which is 14,000 beds, which is Medicaid funded. That program will benefit from whatever Medicaid increase you do, but there are 37,000 other assisted living beds out there that will receive no assistance in this budget, nor have they received any federal aid throughout the pandemic. The state put enormous requirements on these assisted living providers as far as staff testing, PPE. So we're asking for $75 million to support the assisted living programs, which really have not benefited from any assistance and will not benefit in this budget. Next, I'd like to cover the RFP for Medicaid managed care. That will essentially close the community-based not-for-profit long-term care programs who are currently operating primarily in New York City, but in other parts of the state also. So imagine a year and a half from now, you're going to have 100 to 150,000 elderly and disabled people having to change their Medicaid plan. If anybody remembers going through some of the plans that have closed down on their own and the mayhem that created, the thought of 100 to 150,000 elderly disabled people changing plans, I think, is an extraordinarily bad idea, and that the goals that the department is trying to reach can be reached without going through this RFP process. The last 2 pieces, MedTechs, we strongly support that. The single biggest thing you could do to help rural providers is enact the MedTech program. It's extraordinarily difficult to recruit nurses into rural areas, and MedTechs would really be able to fill the gap. Not every person wants to become an LPN, so the MedTech is a great stepping stone for CNAs. And finally, we want to look at the bonus program. We agree that it needs to cover all providers, all job classes. We do think it's important when we have food service workers and maintenance people to be included in the bonus pool. And again, the assisted living program is not part of the bonus pool. So on the same campus, you could have people who are working in the nursing home getting a bonus, but the people who are working in assisted living doing the same or similar job not getting a bonus. So we really need to look at that. Thank you. I appreciate the opportunity to testify.
Thank you very much.
Assemblyman Jensen.
Thank you, Madam Chair. I want to direct my question to Mr. Clyne. You talked about in your remarks about the restoration of the, I believe, 1.5% Medicaid cut. And I know that LeadingAge earlier this year called for a larger cash capital injection. But when we have 70% of all long-term care residents covered by Medicaid funding, why is it so critically important that we appropriately reimburse nursing homes and long-term care for the care that's actually being provided?
Well, you can see right now one of the problems has been the backup of people who are nursing home eligible to come into nursing homes. About 60% of my members on a recent poll we did are controlling their admissions because they don't have the staff. So it has a real world effect on people who shouldn't be in a hospital. They should be in a nursing home where there are programs tailored for them, where there are recreation programs, where there is socialization. You don't get that when you're in a hospital. I mean, hospitals do a great job at being hospitals, but you are not going to solve this problem by restoring a cut and doing 1% across the board. There's got to be more in order for us to be competitive to hire and recruit and retain the people, the staff, our facilities.
So I know in my community and in communities across the state, the governor has deployed National Guard medical units into facilities. Has that made a discernible difference on the capacity for care?
No, it's great for the facility that gets the National Guard, but 6 National Guard people who are there temporarily, it's a big relief and can help with the staff, but that's not going to make a facility open up a unit that they've closed. It's not going to make them make 20 beds available for more discharges. You can't plan like that when you're going to get, 6 National Guard people for a temporary period of time, which again, the state covers more than 70% of the cost or the days. The next biggest payer is Medicare. The government funds nursing homes, and it's the government's responsibility to pay for the care that they'd like to see. So without a substantial increase, it's not going to happen. You're going to have people, staying in hospitals longer than they should be.
And for your members, James, has there been any reimbursement from the state for some of the mandated items that you've had to your members have had to purchase, whether it's been PPE, whether it's been testing supplies, things of that nature?
There's been no reimbursement for it. No.
Okay.
There was a cut in the middle of the pandemic. The state has started sending out more test kits lately, which has been helpful. But again, we've gone almost 2 years now with mandates on testing, PPE, increased staffing to deal with the visitor requirements. So it's just been enormous. And the federal government has provided some aid, but it's only been about 40% of the cost.
Okay. Thank you, James, and thank you, Madam Chairs.
Senator Burrell?
Yes, thank you.
Yes, thank you, Senator.
Yes, no, thank you very much. And first of all, I want to say thank you to all of you for being so passionate about our senior citizens and all that you've done to help them. But I want to direct my question to Mr. Clyne. And I want to specifically dovetail off of a little bit of what Senator Jensen was talking about. I asked the question earlier about the waste, fraud, and abuse in our non-emergency Medicaid transportation. And the reason I bring it up is because, we're paying more to a taxi driver to transport one person to a doctor's appointment than we are for you to care for our senior citizens in a nursing home, with all the costs, all the administrative costs, the healthcare costs, everything else. It's really egregious. We identified this as a huge waste of money, more than 2 years ago, and we've wasted millions more and done nothing about it, unfortunately. And my question to you is, as far as reimbursements, even though we're getting a modest increase, where do we stand as far as, based on today's dollars, which are being reimbursed now, and how far back, essentially, since you've actually had an increase?
It's been
How far
14 years. 14 years since we've had a COLA. We had a 1.5% cut in the middle of the pandemic, and an outside research body did a study of the Medicaid rates across the country, and New York comes in last when you compare the revenue paid to the cost of providing care. We are dead last. It's expensive to run a nursing home. Obviously, in New York, it's expensive to run downstate, in particular, a unionized workforce, which is great. It can help, but the state needs to pay for it, and that's why you're seeing people backed up in hospitals now. You can't get the workers. We're not competitive in the marketplace.
Yeah. Senator Sue Serino, I see her hand.
Thank you, Chairwoman. And, this question is for Jim, but Jim, I just want to say, look, it's 5 o'clock and we're finally talking about assisted living. And I just want to say thank you so much for really highlighting the big gap in funding for assisted living too, because we know how many vulnerable New Yorkers really depend on those services. But I want to know, is it correct that the assisted living workforce would not qualify for the healthcare workers bonuses that are in the current budget proposal right now?
That's correct. That's where some of the confusion comes in. Again, there's a program called the Assisted Living Program. That's Medicaid funded. That's 14,000 beds. But there's 37,000 other seniors getting care in assisted living that will not qualify for the bonus. And they also aren't going to get a Medicaid rate increase because they're not Medicaid providers, yet they've been subject to all these mandates from the state, some which were smart and some which were probably overkill. But the state really needs to do something to invest in these assisted living providers and the seniors that they're serving.
Assemblywoman Burns.
Thank you. Thank you, Madam Chair. Appreciate the opportunity. My question is this, and I want to preface it because I've had lengthy meetings with a CEO of a nursing home in my area, lengthy discussions about how the vaccine mandate forced him to hire otherwise qualified, excellent workers that were lost just because of a mandate that otherwise were great employees. And, it's great, as Mr. Assemblyman Jensen said, that we have had National Guardsmen showing up to help out a little bit, but that's not nearly the number of people that got lost because of the mandate. I'm just wondering what role, if any, has your organization played in making any efforts to try to either preserve these individuals' jobs or to try to get them back into the workforce? Clearly, we have a shortage of healthcare workers. We have healthcare workers qualified that are sitting on the sidelines and would love to come back to work. I'm just wondering, sir, what organization or what your role is going to play?
Yeah, our members did a tremendous amount of education. We support the vaccination of the workforce, but thought that the state needed to do more to help us to convince people to stay in the workforce and get the vaccine. And we're seeing the same problem with the booster now. Again, we support it, but without more resources to help induce people to stay, it's going to be very difficult. We're going to lose more workers. And in the meantime, we're going to be, in the middle of this budget discussion with no new resources.
So actually the situation you anticipate is going to get worse, not better.
Yeah, I just did a poll again on Monday of the nursing homes that were on an all-member call, and 60-some-odd% of them said that they were going to be, controlling admissions or closing units.
Right, that's what
because of the booster. And again, the boost. Don't get me wrong, the booster works. People should get it, but when you have a reluctant population, you need more than just put a Mandate on. You need to provide some inducements.
Right. Would you support a test or rather than a mandate of a requirement of testing in order to ensure the health of individuals that are working in the nursing homes? So like school teachers?
Yeah, I mean, a test out could work if you had the proper PPE, if you had N95 masks, which are now easier to get. So that wasn't really a viable option early on, but that's something we would be willing to look at. The other thing that's important is what's the community spread in a given area. So that's the biggest driver of what happens at our facilities is what's going on in the community.
But at this point, it might be a viable option, correct?
We would certainly look at it.
Thank you.
Cordell Clary. Excuse me, Senator Clary.
I'm sorry. From the last conversation, I just didn't hear what the speaker just said related to what more than the mandate are you recommending? You were saying you have to do more than just put a mandate out.
We called for a Medicaid increase. We wrote a letter to the governor in November asking to do a Medicaid rate increase in order to deal with the understaffing in nursing homes. And it's something that could have been done earlier. We didn't have to wait. Now we're going to wait till April 1 to see what happens. I mean, if you want to impact it, you folks are 70% of the payments. The money's got to come from somewhere. We can't shift it somewhere else. The government is 90% of the payments. And if you're serious about doing it, we need to do something now to try and compete in the marketplace. Because the two places we're going to get people is we're going to get people who aren't employed right now because of various reasons. One is we don't pay enough to get them to come in. And two, we need to be able to compete against other employers.
Thank you. And let me just say, I definitely support more pay. My mother was a domestic worker. She might as well have been working for nothing. And she spent her life raising other people and taking care of other people and sometimes neglecting her own family, not unintentionally. So I am 100% for fair pay.
And we need it across long-term care too. We really need it from everywhere. We don't need to have workers from one place going to another place because the pay is better there. We need to lift all boats.
Everybody, got you. Thank you.